All right. So hi, everyone, and welcome to the ExperienceMedTech information session. My name is Adnan Sayed. I'm at Toronto Metropolitan University, and I'm the administrative director for the MedTech Talent Accelerator Program. This is a program that is a partnership between 4 universities at the moment. It's TMU, McGill, Dalhousie, and Calgary, and graduate students from the BME programs for all the 4 universities, as well as TMU, and at McGill, it's open kind of widely to engineering and science graduate programs, and at Dalhousie and U Calgary, it's only for the BME graduate students that are in those programs. All right, so you're here because we run this program called the ExperienceMedTech program, and that you will learn more about this. Sorry, there's somebody who I need to mute. Please mute yourselves. Thank you. So with that, I'd like to get into this. So I want to start by acknowledging the land we're on. As you all know, that these are Canada is on Indigenous lands. Where I'm in Toronto, or it's called by Indigenous people, or Toronto, which is in the Dish with One Spoon territory. The Dish with One Spoon is a territory between the Anishinaabe, the Mississaugas, and the Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. So we hope to carry that with us. So I'll get into the program. What is the MedTech Talent Accelerator? So essentially, we are a training program, and the purpose of our training is to make new talent like yourselves towards the end of your graduate programs, make you quote unquote industry ready for the Canadian medical technology sector. And we are, as I mentioned, partnered with the 4 universities and biomedical zone here at TMU, as well as the National Association, MedTech Canada, has helped found this program with us. And essentially, the way I would look at it from your perspectives is that the way post-secondary education is structured is in the form of disciplines. So, and the programs you're all in, actually, let's do a quick exercise where if you can just put in the level of program, either a master's or a PhD that you're in, and the name of your program. If you can put that in the chat, please, I would appreciate it. All right, so the programs that you're in, I'm waiting to see if they'll come in. So, okay, there you go. So neuroscience or biomedical engineering and biochemistry and chemistry, these are disciplines that you are in, and you're becoming subject matter experts in these disciplines, in a specialized area of these disciplines. When you get your undergrad, it's at the undergrad level, so it's more general. But then when you do your master's or PhD, you specialize in a sub area of these disciplines through your master's or PhD. So, these are disciplines. So you're becoming subject matter experts. Now, when you turn around and graduate from the institution and you get outside and say, hey, I want a job. Now, jobs are structured within what are called industries. So that's how businesses have organized themselves into kind of an umbrella of different industries. And then that's the way industries, for example, the way industry liaises with government relating to policies or relating to how the company operates within Canada or within Ontario. These associations or these industry associations are the ones that support these companies in that space. So what our goal with the MedTech Talent Accelerator is that, the subject matter expertise you're developing is fabulous. And what we want to do is give you an orientation to this specific industry called the medical technology industry. And that's essentially the goal, so that you understand what this industry is about. How is it structured in Canada? What kind of companies are there? What kind of products do they develop and they manufacture or sell? How do they deal with regulation that's needed for their products, because it's serving the healthcare system. So there's significant regulations around how these products are able to come to the marketplace, the healthcare marketplace, where hospitals and other organizations are able to purchase or use them. So that's essentially the goal. So if you're interested in the medical technology industry as a career path for you as you graduate, we're a good program for you to consider. The minimum you will get out from us is the training. The maximum you will get out from us is a training plus a possible for a step in the door internship. So how does this fit? I want to kind of walk you through your graduate programs that you're in. So we run a series called ExperienceMedTech, where we do regular seminars, and then we also do an annual hackathon. Some of you may have participated in the Hack MedTech that happened last month, focused on the emergency room and innovations around that. And then we also have seminars happening at least once a month. So I believe there is one happening next week. I'll request Mary Susan, if you don't mind putting that in the chat, if there is one. And then so the seminars is really, our way of making programming available to you all as talent, to say that, do you have an interest in the med tech industry? So we try to create a place once a month for you to show up and learn something about the industry through industry representatives themselves. So just last week, for example, we had a nurse who works at actually it was just a few days ago, there's a nurse who actually works in a med tech company, and she provides some very important insights about, the importance of clinicians and people who are doing the healthcare practices and the front line of healthcare, which are nurses, and the importance of having them at the table when engineers and scientists are trying to develop solutions for healthcare. So we actually have a library of our innovation seminars. We have a YouTube channel that you could go on and see all of them, and this recording will be there as well. Or you could go on our website and look at events, and we have all our seminars recorded and linked. So if you want to kind of on demand go in and see what we've hosted before, and really I would suggest doing that to see, what captures your interest in the industry, and I'll really help you better navigate your careers in it. So these are available to everyone. So your seminars are live and public. And just as Mary Susan put forward, there's a modeling of industrial drug development that's going to happen next week that you can attend as well as a seminar. So the ExperienceMedTech is what we're talking about today. Now, this is really focused on students that are towards the end of their degree. So around their final semesters in their program. And it's really meant for students that have a very good idea of where their research is at. Because what we need is, the eligibility is that when you take on an internship through us, if we're able to provide you one, it has to be in a period of time where you've done your coursework and your bench work on the research, and you're into your writing phase of your research. And that's when we are providing or facilitating or attempting to facilitate internships for new talent, where they're in this writing phase where they can take on a full-time internship while in this writing phase of their thesis. And I like to put this up front. You can see that asterisk right there about internships on the slide deck. The bare minimum that you can anticipate through such an internship through us is $10,000 for a 4-month internship. And that's the bare minimum that we stipulate with the companies. And this is also based on there's wage subsidy programs that companies are able to access to have interns like yourselves. And that's kind of the minimum they've set. So we follow that as our minimum. So these are not volunteer internships. We don't facilitate any sort of volunteer internship. So no free labor here. At minimum, you're supposed to be paid. If we are able to get you an internship, the minimum will be $10K over 4 months. So this next slide is just to kind of give you kind of a perspective on what we've facilitated so far. So these are kind of shows you some positions and titles, position titles that we have facilitated, as well as these logos represent companies that are in our network that have actually hired our interns. And if you'd like to see an updated list, we have a partners page on our website where you can actually see a list of our partners that are there. And it's good to also become familiar with these companies. If you're interested in medtech, these are the ones that have really saw that, new talent is important to integrate into their companies as they look to grow. And they're really at the forefront of that. So if you're a new talent looking into the industry, this is a good roster of companies to start with to try and enter the industry. And now we'll kind of describe a little bit about the training. So as I said, we're an industry orientation focused program. So we want you to know what the medtech industry is about. And really a number of these elements are usually not covered in post-secondary educational programs. So that's why we exist as a layer on top of your programs where you can become familiar with the medical technology industry. So here, what you can see is we have 4 badges that we are that we offer to you. These are self-paced training modules that are online. So these are modules that you would take on your own. So we've created these training modules and we've placed them in a learning management system, and we give you access to it as soon as we see that you're eligible to be in our program. And I'll talk about eligibility in another slide that's coming. So in this training, we are looking to get you better oriented with the medtech industry, and it starts with talking about how does the business work and how does commercialization work, because there are a significant amount of startups and small medium-sized medtech companies that if you saw the previous slide and the companies there, a lot of them are SMEs, small medium-sized enterprises, or startups. So they're all looking to either they're already commercialized or they're looking to commercialize the IP that they've built up in their companies. And then we focus a bit more about industry R&D. How does the industry do research and development to develop a product, get it approved by Health Canada or FDA, and then get it to market? And what are those steps? So you understand what those steps are. Also look at quality management, which is very important for products that are getting out, as well as the elements in regulatory affairs that you need to be mindful of when you're doing research experiments to validate your product for the regulatory authorities. The third badge is more general, so it's more about employment skills, where we share with you cross-cultural team communication. Project management is seen as a very key skill and experience. Each of you, if you're doing a thesis or a major research paper, you're doing a project. And there's a start to a project, and there's an end to a project, and there's all these steps in the middle that you're taking, be it proposal writing, defense, doing the experiments, then doing the write-up. These are all steps in a project that you're taking on. So think of your thesis also from that lens, and that's very important, as the work in these companies usually is project-based and not standard operating procedures that you just need to repeat. We also give you some skills around writing emails and talk about reports. And then our final badge, which I think is our flagship badge, which is focused on virtual clinical immersion training. So this is important because, if you're thinking about the medical technology industry, in order to be able to work in a company that's developing products or services for a healthcare system, you need to understand the healthcare system that these products and services are going into. So our badge 4 is essentially our effort to make you as aware as possible at a high level how the healthcare system in Canada, for example, is structured, and a variety of different angles of that healthcare system for you to know about. So AI in healthcare, and other topics and social determinants of health, and there are other topics that are part of this. We also, in our kind of second subset of this badge 4 training, we're wanting you to see for yourself through video capture that we've done of essentially simulations of a healthcare practitioner intaking a patient, diagnosing them, and then applying some therapeutic services or efforts, and how they're using medical technologies to do all of this. So we have some videos that are actually shared with us through a notable hospital here called Unity Health in Toronto, and their education team has actually developed this for us. And then finally, we want you to also interact a bit, and while these most of the training that you're getting from us is passive learning, so it's content that's being given to you, and we'd like you to absorb it and do a comprehension-based test about it. We also have a VR experience, but we also have a version of it which is a keyboard and mouse kind of experience that you can take on, where you get to experience being like an ultrasound technologist running an ultrasound scan, or being in an MRI room and what that looks like, and taking some actions that such practitioners do as they run the technology to get diagnoses or do therapies with a patient. So you have a bit more, interactive understanding of how the healthcare setting works. So all that culminates into our 4 badges that essentially, and we've designed these, being very clear about this, we've designed these with clear input from our industry partners. So this is Health Canada. We have a rep from there on our advisory board, a leader from there, and then we have others in the industry locally that have actually contributed these topics and said, new talent showing up to our door to work. It would be amazing if they know how these elements work and have an understanding of that. So that's where this has come from. So this is not just us sitting on our separately and saying, this is what we think you should know. This is what employers think you should know in the medtech industry as you think about your careers there. So let's get into, eligibility. So as I said, currently who's eligible to be part of the MedTech Talent Accelerator's ExperienceMedTech program. It's graduate students from these 4 universities, TMU, McGill, Calgary, and Dalhousie. Specifically for TMU and McGill, it's open to all STEM-based graduate programs that are research-focused, so not course-based. It has to be a research-focused program. For University of Calgary and Dalhousie, it's open to all BME graduate programs. So for Calgary and Dalhousie, it can be a course-based program as well. It doesn't have to be just research, but it has to be a graduate program. All right, so that's the first eligibility piece that you need to check mark that is this you or not. And then the next piece is really, we need this confirmation from you as well as your supervisor, and with the supervisor, this needs to be a signed form from your supervisor and yourself. And this is really to estimate to the best of your ability when you'll be in your writing phase of your thesis. So this is more towards people who are doing a thesis, and then if you're doing a course, so when you'll be in your internship, when you'll be ready to take an internship, what date do you see that being? In this round, we are actually intaking students who will be ready to do an internship and be in the writing phase on May 1st, 2023, or September 1st, 2023, or January 2nd, 2024. And I understand, you know, the further out we go, the prediction is less 100%. It's more of an estimate. So you have the ability to change it. So, you know, imagine you apply for the January 2024 round, and say in the summer you realize that, you know, you won't be done in January. You'll actually be done next May, so May 2024. We do have a mechanism through which you can update your availability after you've entered our program. Okay, so this is your second eligibility requirement. You need to fit within these 3 dates for, and this is a form that we have on our website that you need to download and have your supervisor sign off, so that, and this is also important from the supervisor perspective, is, you know, we need your supervisor to be aware that you're taking this on. This is really important because you're in graduate programs. We don't want any issues between yourselves and your supervisors as you take on this program. So we need this to be an upfront and a proactive information that you're sharing with your supervisor, and your supervisor is signing off on it. If your supervisor have any questions, you know, you can direct them to our program, medtech at medtech@talentaccelerator.com, and we can address any questions they may have. We're happy to field those from you. Okay, but this is a sign off for when you're available for your full-time internships. So just in terms of dates, now, when do we need you to apply by? We need you to apply by, for this round of intakes, we need you to apply by March 15th. As soon as we gauge your eligibility, we will make our training available to you. So as I said to you, the worst case, if you're eligible with us, the worst case scenario of joining our talent pool and being considered by companies, the worst case scenario is that you walk away from us with just the training, that we may not be able to land the internship for you. The best case scenario is that as we promote our talent pool to industry on an ongoing basis, somebody from industry picks you up as an intern. So we have a whole talent bank model and a platform that the industry uses through us to make requests for interviews to our students. And as they come in, you would get an email from us saying there's an interview request. And then you would, if you accept the interview, then you go through that process, and then a proper offer is presented to you, which you get to accept based on your availability and based on the company's interest. So very important here, we do have a policy around offers of internship. So actually, and the interviews as well. So if you reject more than 3 interviews from us, that we've provided to you, we withdraw you from our program. This isn't for anybody who's like, I want to work for this one company that's on their list. If they give me an interview, I'll take it. I'm going to reject everyone else. If that's your mindset, we're not a good program for you. We're really a good program for someone who's open to a first experience internship in any medtech company that thinks they can add value to their company. So we really need you to be open-minded as you're applying to our program. And so that's a caveat in our policies where, if you reject more than 3 interviews, you are withdrawn from our talent pool. And if you also reject more than 2 offer letters, so if you've done the interviews and you've been given an offer and you decline it at the offer stage, we allow you to decline twice. After that, we'll have to withdraw you if you do decline that second time. Again, as I said, this is our effort is to get your foot in the door in a first-time internship in the industry. If you are not that flexible, then it makes it really challenging for us to find companies, the interns, and for the interns to actually land internships. Okay, so I want to be very clear about this. So now that you understand what your eligibility is and you see yourself as eligible, and then you see the policy we have for you to participate in our program. So what do you need? What do you need to apply to us by March 15th? So for you, first and foremost, you need to have a conversation with your supervisor, and there is a PDF form. We can, I'll request Mary Susan to drop the Google form at the end of this presentation. We'll give you this slide deck so you can access it. So there is a PDF form that you need to fill out with your supervisor. It's a simple one-pager just indicating when you'll be available, when you'll be in the writing phase and available for a full-time internship. This is for our purposes. This doesn't get circulated beyond our admin staff. The second item, sorry about the numbering. The numbering is off here, but number 2 is resume. So here we ask you, we have a very unique ask for resumes. And I want to be very clear about what that is. So one is we strongly recommend that you connect with your career center at your institution and get your resume reviewed by them, that your resume is actually of high quality. So there's no formatting issues. There's very clear and crisp descriptions of what you've done and what roles you've taken on and etc. So please, that's a recommendation from us. If the resume is of poor quality, we do reject resumes if they've just been, randomly submitted with not a good amount of attention to the quality of the resume. So that's really important. So for focusing on the quality. And then in terms of contact information, now this is important. Please, if you're applying to us in this round, this is really important you listen to this because this is really critical for our talent pool that we collect. For privacy reasons, we are not allowed to share any resumes that have your contact information on them. Okay, so you need to remove your home address, you need to remove your email, you need to remove your phone number, and we also need you to remove the way we want your name to be, as well as it needs to be just your initials. So it needs to be, say, my name is Adnan Sayyib. On my resume, it will say AS, and that's it. It won't give my full name. So this is important for privacy reasons. We do circulate our talent pool widely and publicly to the industry. So for safety and for privacy, to comply with privacy laws, we are not allowed to circulate your full name as well as your home address or emails. We're not allowed to circulate that through our talent pools platform. So that needs to be removed. The only thing you can put down there, so it's your initials as well as your city and province. So I'm in Toronto, it'll be Toronto, ON. Okay, so this is very important. This is an administrative piece that we require you to follow if you submit your resume to us. There will be no exceptions. Now, inside your resumes, as I mentioned, a key thing that we see employers look for is project management knowledge and experience. So definitely consider highlighting your project management skills in your resume. There are also micro credentials that sometimes are free. I don't know, some institutions have access to LinkedIn Learning, for example. Those LinkedIn Learning has a project management kind of micro course that you could take. So if there's anything you can capture in terms of, what your project management knowledge experience is, please make sure you highlight that in your resume. So that's seen as important by the industry. And then again, short and concise is better than long and lengthy resumes, or CVs they're called. So please keep that in mind. Your resume is 1 to 2 pages max. It's not your CV that you're submitting to us. It needs to be 1 or 2 pages that you're giving to us. So that's with your resume. So this is the primary document that we present to our employer partners to consider interns. So this needs to be of high quality, as I mentioned, and as well as following these administrative items that we are highlighting to you. The second item that we share about you to the employer partners is essentially a shortened version of a cover letter. So what we've done is, instead of you giving any cover letter for a specific job, we want you to make a pitch of yourself for why you want to work in the medtech industry. and we want it to be short and sweet. So it needs to be a maximum of 650 characters. So here it's just, write a paragraph about what is it about the medtech industry that interests you and why you want to be in it and any strengths you bring to it. And this is something we showcase to the employer for each applicant, for each talent. And then the third thing that we showcase to employers, and the last thing is we want you to record a 1-minute video of an interview sample. So the question that we want you to respond to is, if your manager asks you to complete or do a task or project and you don't know how to do it, what are you going to do next? What are the actions you'll take to deal with that? It needs to be a 60-second equals 1-minute video. It cannot be 1 minute and 10 seconds. It can't be 2 minutes. It can't be 3. It has to be 60 seconds. It can be lower than that. It cannot be higher. So we will actually ask you to redo it if it's higher than 60 seconds. We also don't want, some of you with your have incredible video editing skills, probably based on the social media content we're able to now produce with our phones and things like that. We do not want you to apply those skills to this video. We would like you to keep it a simple video. You're dressed professionally in the video, you're looking at the camera, and you're introducing yourself briefly, and then and responding to this question and stopping the recording. It needs to be a simple recording, and it needs to be just on your phone. You can do it. Just make sure your background is not busy. It's a plain background. You're dressed well. You're looking at the camera and you're speaking confidently in responding to this question. So that's the 1-minute video we need from you. So these are the 3 elements: the resume, the pitch, as well as this video is what we make available to our employer partners for every single talent that we have in our talent pool. And they get to browse that to decide who they would like to select to interview and hire from our talent pool on a regular basis. The final thing we need from you, and this is only going to be seen by our administrative staff. Mary Susan here is one of them, and we have Jesse and McGill, as well as we have others at Dalhousie. I think it's Heather at Dalhousie and Andrea and University of Calgary. That help us do this review of making sure you are eligible. So they're the only ones from your institution who will get to see your unofficial transcript and verify that you are eligible for our program. We do not share transcripts with anyone. It does not go beyond us or our administrative staff. It is never shared with employers. It is never seen or indicated, or anything from that is ever given to anyone outside of our admin staff for eligibility. Okay, so I want to be very clear, we do need it, but it doesn't go beyond us. So this is not something that you will be evaluated on if you're being considered by the company. So those are the elements in terms of how to prepare. And I think that concludes my kind of presentation. So please, what I want to say is, please look at our website. If you want to get more familiar with the medtech industry, we have a library. We have at least, I believe, by this time, we have about 30 different innovation seminars that we've hosted by now in the last 3-4 years. You can access that through our website. It's available. So please look at that to see where your interest lies in the medtech industry. Our email is medtech@talentaccelerator.com. So if you have any questions, that's where you send it. And where we post everything first is our LinkedIn page. So as you're thinking about your careers, I highly recommend building up a very high quality LinkedIn profile. That is something that recruiters look at on a regular basis. And then please do follow us on our LinkedIn page as well. You'll see a lot of content about the industry, about events, about activities that we're doing and others in the industry are doing on our LinkedIn page. And that's a really good way to start getting in the know of what the industry is doing and about. All right, so with that, I want to thank you for your time. Thank you for making the time to be joining this information session. I really appreciate it.